go into the room, identify my patient, and make sure this is the right patient who's about to receive what I'm about to give. So, hello, sir. My name is Nurse Dominique. I'm going to give you an injection today. Can you tell me your name and date of birth, and if you have any allergies? So what he says, what his response is, I would compare it to his bracelet here. Sam Jeffries, born November 12th, 1960. I can also see on his bracelet that he has no known drug allergies, and so this is the right guy. All right, so now that I've established that, I'm going to go over here, gather my equipment. So the first thing that I'm going to look at is my MAR to make sure that that everything is correct there. So the MAR will tell me the time, the patient, the medicine itself, the route, and the dose that I'm going to need for all of this. So I'm looking here, it says 2 millimeters of, let's say, sodium chloride, 0.9% sodium chloride. And my needle here has 3 millimeters capacity in the syringe. The needle itself is 21 gauge and 1 inch in length. I'm going to need also as my equipment some alcohol prep swabs, some gloves, my sharps container, all of these things. So when I look at the MAR and I'm looking at the medicine, I'm going to check not once but twice but 3 times to make sure that it's the right medicine. The first check happens as I pull the medicine out of the jar. So 0.9% sodium chloride for this guy, this time, with this dose. All that information should also be here, so I compare the two. Check number 1, when I pull it out. Check number 2, and hold it directly to the MAR and look at it to make sure it's correct. I'm going to take out this alcohol swab and swipe the top of the bottle. This is going to be my third check here. Looking at the bottle, on the information, make sure that it correlates with the MAR. Okay, so I'm going to take off the needle cap, pull the plunger back to 2 milliliters, so it's just 2 milliliters of air. This has been sterilized already with this alcohol swipe. Push it in, push the air in, hold it up to eye level, and pull back to 2 milliliters. There's a big old bubble at the top here, so what I'm going to do is pull back a little farther than I need, and then slowly push up to get rid of that bubble. There we go. Now there's no more bubble, it's just 2 full-on milliliters of medicine. So, before we go into the patient's room, I'm going to recap the needle by just keeping the cap on the table, lifting it up, pushing it down. Okay, and so now I'm going to come into the patient's room. Hello, sir. I'm going to give you your injection. For decency, I'm going to sort of keep his genitals covered as much as possible, but get his right hip exposed. The ventral gluteal site is right around here. The way you find it is you put, if it's his right hip, it's going to be my left hand on the hip. Point the thumb to the groin, point the pointer finger towards the tip of the hip, and then in between this V that I would be making with my hand, that's the site that I'm going to use. So I'm just going to use this wipe, find the spot, line it all up. There's my site. Cleaner the alcohol. And actually, a trick to make sure that you have the correct site when you get the needle and come back is to leave this on his skin and then have the corner point to where you're going to inject. So I'm going to do that so that I don't lose my spot. Okay. You can do another patient identifier if I want. Name, date of birth, any allergies. Uncap my needle. IM injections are 90 degrees going in, but standard intradermal, but this isn't that, so I go 90 degrees straight down. Okay, so I have my spot, it's already there. On 3. All right. 1, 2, 3. Push it in. Aspirate a little bit. Pull back. Make sure there's no blood. Make sure that you're not in a vessel. And then push all the way through at 1 milliliter per second. After that, I'm done with this. I don't need it anymore. I would put it in the sharps container. I'm just going to put it on top because that's my practice video. And then I can hold pressure on this if it was painful, but usually it's just pretty quick. 1, 2, 3, go. Get rid of that. Cover them back up. During the process, it's a really good time to talk to the patient, see what they know about their medicine, if they know why they're taking it. If that would be a great time to teach if they didn't already know more about their medicine, more about their own disease processes. After all of this, I would go back to the MAR and document the entire ordeal. I would say what time it was, 0800. I would write down the name of the medicine, the dose, maybe patient diagnosed with this, and this, and then what they were given. I would also write down where it was given too. Right ventrogluteal site. Patient responds no pain, because when I asked him over here, and I asked him after it, he reported no pain. So there's the objective information, the subjective information. Thank you so much. That's it.